Hi, I'm Rhonda Pick, Managing Editor of Pig Health Today, and joining me is Dr. Kim VanderWaal. She's an assistant professor in the Department of Veterinary Population Medicine at the University of Minnesota. Kim, thank you for joining us.
Thanks for having me.
For several years, your group has been working on developing a prediction model to help forecast swine disease outbreaks. You've been particularly focused on PED. Briefly describe how this model works.
Sure. So yes, we've been working on this project now since around 2017, and essentially we wanted to move from a situation where we're monitoring disease in the pig population in the U.S. to a point where we can use that information to actually forecast what we expect to happen next. So we work closely with several companies or production systems in a specific region of the US. And we also partner with the Morrison Swine Health Monitoring Project. And key aspects of the project is that for many years now, these companies have been reporting the infection status of their sow farms to the Morrison Swine Health Monitoring Project. So now we have this great data set that shows each week whether any given farm is infected with PED. And we also combine that with the animal movement data, both to the sow farms, but also to neighboring farms and downstream farms, to try to build a predictive machine learning algorithm that actually forecasts when we expect there to be a high probability of a PED outbreak.
So what's the overall goal for this prediction model?
So the overall goal of our model is to be able to project 2 weeks in the future the likelihood that a sow farm is going to break with PED. So we could project that in two different ways. We give a dichotomous, yes, it's going to break, or no, it's not. And we also give that as a continuous probability, which is probably more useful, where we go from 0, your farm is probably pretty safe, to 1, which is, danger. And part of the goal of this is that risk factors can change through time, especially when you talk about things like animal movements, where the nature of movements and the nature of that movement network changes every week. And so we try to account for those changes through time. So we're hoping that we actually can give a better picture on the current risk for a given farm based on animal movements, where those movements are coming in from, as well as the current distribution of the disease in the broader industry. And so we hope that this is going to enable producers to make better data-informed decisions about any sort of interventions or mitigation measures on their farms.
I know some of your previous research, you've reported that there are a couple key factors that really drive about 75% of the transmission between farm activities. What are those couple of factors and why are they so critical?
Yeah, so that study was on the early emergence of PED in 2013, and we used a slightly different approach in that case. But essentially, we are trying to contrast different potential between farm disease transmission mechanisms. And what the model showed us was that the most important factors during that phase of the epidemic were animal movements as well as local area spread. So that's any factor that where farms are more likely to transmit to each other if they're in close proximity to each other.
What challenges do you run into as you're trying to collect more real-time data for animal movements?
Yeah, so it was important for our project to actually be able to forecast out in the future, at least what we target right now is 2 weeks. It's still not a very much amount of time if you're expecting a producer to actually be able to respond to that forecast. However, if we tried to predict 3 or 4 weeks in the future, you can imagine as you put that timeline farther and farther out, your predictions get worse and worse. One of the things that we use then is we actually use the scheduled movements for that following week. So what are next week's movements going to be, which then would influence the risk of an outbreak the week after.
So what's your best case scenario as far as recommendations on what kind of data, what criteria do you need to make things work the easiest from an integration standpoint?
Right. So the two most important pieces for us is first participation in the Morrison Swine Health Monitoring Project, because without that, we don't have basically any infection data to work with. So a lot of the work that their team is doing is what enables our project. So continued participation or maybe increased participation in that program is certainly essential. As far as animal movement data goes, the minimum of what we need is we just need the origin location or the site, or the destination, and the date, and then the number of animals moved. So most systems are recording that information in some format, and I believe that they may be required to in the case of a foreign animal disease outbreak. They have to be able to show where their animals have been moving.
Last time we sat down and talked with you about this research, you were in a phase of predictive analysis. Talk more about what is the current status of rollout and implementation of this within the U.S. pork industry.
Since November last year, we have been delivering these forecasts on a weekly basis out to our partnering companies that have been with us as part of the pilot portion of this project. So since November, they have been getting a weekly report of their sow farms, with their sow farms ranked according to which ones were most at risk in any given point of time.
And do you have any criteria you would consider for farms that are getting the most value, that have the highest accuracy in their data? What are they doing right?
We've had feedback from them that of how they're using these forecasts. And one is to basically shore up biosecurity. You could argue that all sow farms should have perfect compliance with their biosecurity at all times. But in reality, there's probably reminders that need to happen, and maybe retraining of staff occasionally. And then the other way that they're being used is for these farms that have a low probability of break. It's actually been used as kind of almost a reassurance that, like, okay, right now we should be comfortable in not taking certain steps right now because our risk is low. So it's being used to help try to make those cost-benefit analyses, and sometimes the decision is well, we don't need to do anything right now because we're not at high risk right now.
What do you consider to be any potential limitations with the forecasting tool?
Well, I think what anyone will tell you that's been out in the field is that predicting outbreaks is really hard, and even when you have an outbreak, it's really hard to know where it came from in many cases. And that's certainly true in our case. So our forecasting pipeline right now has a sensitivity of around 20%, which means for every 5 outbreaks that occurs, we detect 1 of them, which also means we miss 4 of them. So, if you could consider that, well, that's actually not very good, but in reality, that's more information than we had before we weren't able to predict anything. So I guess it's a modest improvement. And one of the things we have to carefully weigh is that if we try to improve the sensitivity, we basically create more false alarms at the same time. The positive predictive value is 70%, which means that for every 10 times the platform predicts an outbreak, it's right 7 of those times. And so that means that there's not very many false alarms. And if we increase the sensitivity, there'll be more false alarms. And talking with our partners, they don't want to get a bunch of false alarms, because essentially if you cry wolf too often, then people stop responding. The other challenge that we have is we incorporate, animal movements, local spatial dynamics, what's going on in the surrounding neighborhood, but there's still a lot of pieces that we're missing. And that's partly because the data is not available for, say, biosecurity practices. We don't really have a standardized database of who's doing which measures when. And that's true of a lot of other things like feed trucks and how feed trucks might be moving between farms and anything else that could carry fomites between farms. So we do certainly have some missing pieces that we're just unable to track, therefore we're unable to put into the model.
If you look at the PED model, what investments need to be made in that in the future to scale it up for broader use within the industry?
Yeah, so we've designed our software to be scalable, in that the beta version of the software is supposed to be able to take in new data, for example, from a new system that is just now joining our project. there is still some work to be done in terms of making sure the data is formatted the right way, that we can actually input it into our system, that we figure out how are we going to transfer movement data on a weekly basis. So there's a number of steps there that can be quite involved depending on how the system is currently managing their data.
We've been talking with Dr. Kim VanderWaal, assistant professor at the University of Minnesota. Kim, thank you for joining us.
Thank you so much.